Yes. So I'm just giving you a review once again. So first you are starting from here. Yes, Nasra Muhammad. So we are starting from here. Community nurse. Just as it is, you are going to write here community nurse. C capital letter, N capital letter, remember. Then next, community health center. Community health center. Then next, Woodville. So this is called relevant, finding out relevant information. So community nurse, community health center, Woodville. So that's it. Then this is a referral letter, remember that. This is a referral letter, be careful. Referral letter. So we have written the address, 3 lines are there in the address. So next one, you're writing the date, write today's date. So 13 February 2010, because this letter is 2010. So last attended January 2010, so February. So we are writing today's date, that's all. Year, same, let it be the same. Okay, we cannot make 13 years difference, so let it be like that. So 2000, only the month we're changing. But on the exam day, you'll write the day of the exam date, that's all. So this is relevant information. This is last attended, and you are writing after that. Yeah. So next you are going to write dear nurse. This one. The second, we don't want community nurse again. So just a dear nurse, simple, short and sweet. Dear nurse. Then salutation. Salutation is Monica Osburn, the name. The patient's salutation we have already written. So this is regarding line, Miss Monica Osburn. Why Miss? Because she is divorced. That's why it is Miss. Okay, because she is divorced, we write Miss. Okay, if she is married still, then you'll say Mrs. But she's already divorced. So you'll say Miss. Remember that. So regarding colon Miss Monica Osburn, comma, aged. Is age given? Yeah, age is given 69 years. So age is 69 years. So aged 69. Fine. Aged 69. That's it. Now you are writing. So 4 parts are over now. This is the address. This is the date. This is the salutation. This is the subject line. This is the subject line. All of you who are attending the session, just write your first name and second name. For example, my name is here. My name. So you should know my name, Simon Peter. So like this, write first name and second name. All of you give your attendance that you are present, so that I'll know about you. So this is it. Then next one, you'll write the body of the letter. The body of the letter. Then you will write the closing remarks. Yours faithfully. Why faithfully? Because you are writing to a nurse. If you are writing the name of a person, dear Mrs. Thatcher or something like that, then you will write yours sincerely. So here you are writing yours faithfully. Then next 2 lines. So 1 line, 2 lines. Okay, you leave 2 lines here, 1 and 2 and third line you will write. Leave 2 lines here because signature and name should come here. Signature and name should come here. So 2 lines are needed. And so you are the attending nurse. You are the attending nurse. So just write a registered nurse. Okay, or attending nurse, registered nurse. Okay. And registered nurse, where you are working, health center, Newport Community Health Center. You are working in Newport Community Health Center. Newport Community Health Center. Okay. So copy text, write as it is, Newport Community Health Center, and this will be in Newport only. Newport Community Health Center will be in Newport. Now we are going to write the body of the letter. The body of the letter will be written in 5 lines. The introduction, then the main body paragraph 1. Okay, then next the main body paragraph 2, 3, then the conclusion. So these are the 5 paragraphs you are going to write. 5 paragraphs you are going to write. Okay, this is how the other things are there. So address first, then the date, then salutation, subject line, closing remarks, and your address, sender's address. This is the recipient's address and this is the sender's address. Okay, so we got the basics now. The basics, these are the basic information. These are important. So is that clear enough? So if it is clear, just say yes. If it is not clear, say no, so that I'll ask you any doubts. Okay, right? Yes, come on. If it is clear, say yes. We are moving forward to the main body of the letter. Come on, fast. We don't have all the time in the world. Okay, just fast. Yeah. Yes. So now we are going to the introduction first. Now let us go to introduction. Introduction. How are we going to write? What are we going to write? So here the subject is Miss Monica Osburn. So just write Miss Osburn. Always start with Miss Osburn because patient is important. Don't say I am writing to introduce, I am writing to refer, I am writing to discharge, I am writing to transfer, I am writing to provide information. All these are ordinary quality. Ordinary quality. You should know that it is ordinary quality. I'm going to take you to the official website now. I'm going to take you to the official website. Many people are writing, I am writing to refer, I am writing to discharge, I am writing to transfer, I am writing to provide information, I am writing to update the information. I am writing to you, I am writing to provide you the information. All this too much beating around the bush. Now, what do you mean by beating around the bush? Beating around the bush means, what it is? Beating around the bush. Beat around the bush means talk nonsense. This is an idiom. This is an idiom. C1. C1 means not everyone can use. To avoid talking about what is important. Don't beat around the bush. Get to the point. That's the point. Get to the point. Talk the main points. Don't talk all nonsense. Who are you to write about yourself? You're not important here. So OET, official writing nursing, OET, official website, OET official website, writing, okay, active or passive. So you can see OET official writing, active or passive, which is important. Do you know how to write the passive forms correctly? Do you know how to write the passive forms correctly? What do you mean by this? What do you mean by this question? OET is asking you, do you know how to write passive forms correctly? OET is asking you, do you know how to write passive forms correctly? So here there are 3 points. So there are 3 points here. There are 3 points here. The first point is, in this question, there are 3 points. Okay. There are 3 points. First point is, you should know that passive forms are important. Point number 1, passive forms are important. Point number 2, you should write passive forms. Number 2, you should write passive forms correctly. So these are the 3 sentences. Passive forms are important. You should write passive forms. You should write passive forms correctly. In the other way around, I will tell you the most important one. You should avoid writing active forms. This is what is more important. This is what is more important. So try to understand. Okay. This says that you should give importance to the main things. That means stop beating around the bush. That means talk straight to the point. That's it. So, do you understand the importance of what I am telling you? These are not my words. These are the words of OET. Do you understand what OET demands from you? Do you understand what OET demands from you? Say yes if you understand. If you are against this point, say no. I will do whatever I want. Why I should listen to OET? That is your problem, your headache. Okay, that is why many students are failing 3 times, 4 times, 5 times, 6 times, 7 times, and they are crying. Okay. So this is what it is. Say yes if you understand the importance of what I am telling you. I have given you through official OET. Official OET is telling, do you know how to write passive forms correctly? That you have to understand. This is the heading. Now see here, passive forms are great. Passive forms are great. That means active forms are not great. Passive forms are great. That means active forms are great for making the patient or treatment the focus of the sentence. Instead of making the patient or the treatment the focus of the sentence. See here. Here, I'm making the patient the focus of the sentence. But many people write, I am writing to refer Miss Osburn. But I am writing, Miss Osburn is being referred. That is the difference. Everyone can write this one. 99% of the students can write this one. If you write like this, you will get A grade. If you write like this, you will get B grade. And if you write like this, I am writing to you, I am writing this letter to you to refer Miss Osburn. You will get a C grade. This is called beating around the bush. This is itself nonsense, and this is Everything, all the three mean the same. There is no difference. There is no difference. Everything is one and the same. Do you find any difference in these three sentences? I don't find any difference. But this is outstanding student, this is moderate student, and this is useless student. Is lack proficiency. Very cheap quality. Very cheap quality. This is cheap quality. This is ordinary quality. This is the best quality. So now whichever you want to write, your wish. I'm not forcing you. You should write like this, you should write like this, you should write like this. So start with the newly introduced thing, that is enough, straight to the point. So I'm eliminating these two now. So just to show you, I have shown all those things. Right. Miss Osborn is being referred. Now who is Miss Osborn? Who is Miss Osborn? Right. Right. Now let us see here. Miss Osburn, yeah, who was diagnosed with hypertension and depression. Okay, right? Who was diagnosed with hypertension and depression. Right, this is one point. This is the diagnosis long back. Okay, diagnosed with hypertension and depression. So we are treating her now for the last many years. How many years? So 2003 to 2010. Diagnosed when hypertension is 10 years and depression is 2 years. Okay. Hypertension is 10 years, depression is 2 years. Recently started depression. Okay. So try to understand. And these are the medications. Now, so here, regularly monitored by community nurse in Woodville. Okay, now she's moving to Woodville. She's moving to Woodville. Right. Now here, so you are requesting what? Continued care. You are providing relevant information about her and you are requesting continued care. So now what you have to say here? Continued care. So this is required here. You are requesting continued care. Requesting continued care. You are providing relevant information. Relevant information, you need not write all these things. You are outlining relevant information and you are requesting continued care. This is what you require. This is the purpose of the letter. The purpose is to provide continued care or ongoing care. So don't write the same word continued care as it is from here. Continued care, change it. Okay. So here, Miss Osborn is being referred for what? For ongoing care or continuing care. Okay. So ongoing care and appropriate management. Right. So Miss Osborn is being referred for ongoing care and appropriate management. Yeah. So fine. Right. Miss Osborn is being referred for ongoing care and appropriate management. So fine. Now many people will write Miss Osborn, a 69-year-old woman, okay, like that one. Lot of different things they write. So all those things are not needed because already we have mentioned here age 69. Be as short as possible. As short as possible. Don't write too many things. Don't write too many things. Yeah. So now let us see. What else? Right. So is being referred. Referred means you are introducing them. Referred. What do you mean by I am introducing? This letter is to introduce Miss Osborn. Why? Refer means introduction only. Many people write like this. I am writing to introduce Miss Osborn. Okay, I am writing to introduce Miss Osborn. Okay. So why do you want to write introduce? Because do you know the meaning of the word refer? If you don't know, let us learn now. What is the meaning of the word refer? Refer. Refer someone to somebody else. Right? Refer someone to something. This is a very special thing. Refer to someone or something. So it is, if writing, okay, not this one. So here it is, phrasal verb. It is C2. Very powerful word. Refer is a very powerful word. C2 vocabulary. Refer is a very powerful. I am referring Miss Osborn to you. That is the meaning. To you only here. To whom? To community nurse. Understood? Why should you tell I am referring her to you? Okay, is being referred enough? Okay, I am writing to introduce. Introduce means what? See here. To direct someone or something to a different place or person for information, help or action, often to a person or group with more knowledge or power. My doctor referred me to a hospital specialist. Okay, try to understand here. It is C2 vocabulary, and you are using, instead of refer, you are using what? Introduce. What is the level of introduce? Introduce is B2. Introduce is B2. Now I want to tell you what is the style of these words. What is the style of these words? Now I am going to tell you about CEFR levels. Okay, CEFR levels. Now what are these CEFR levels? I will take you to again official OET. Official OET. CEFR and OET scores comparison. So see, this is official OET. This is new official OET. You can see here official OET, www.occupationalenglishTest.org. What is it telling you? What type of words you have to use? Now, new report shows how OET compares the standard of language. What type of language you are using? Are you using excellent language or ordinary language? So now OET, medicine, nursing, pharmacy, dentistry, all 12 professions, all the 12 professions. Okay, you have to use CEFR band and OET scores. Okay, and OET results. See, these are the things. A grade. So you will get what level you have to use. C2 vocabulary. Now C2 vocabulary, I'm copying this C2 from here. So C2. So I'm giving you the different levels as it is. C2. C2. Okay, C2 level. C2 level. CEFR is C2 level. And now if you are using C2 level vocabularies, then what score you will get? You will get 450 to 500. 450 to 500 score. That means your OET score will be 450 to 500. So minimum 450 to 500. That means you are going to get A grade. A grade in your OET. These are the scores. And these are the grades. You're going to get A grade. So right. So next one, C1 level. If you are using C1 level, the score will be 350 to 440. C1 vocabulary. You'll get 350 to 440. 350 to 440. I hope you understand now what I am telling you. You will get a B grade. Okay. Next one, B2 vocabulary. B2 vocabulary. B2 level. And B2, you will get how many marks? 300 to 340. 300 to 340. You will get C plus. C plus. Then next, B2 level, you will get 250 to 290. B2 level only. This is OET is telling, okay, not I. I'm not telling, this is official OET. See here, official OET. Okay, come occupationalenglish.tester.org. You can see here. Okay, if you want, I'm posting the link here. Listening or not listening, it is your wish. I'm telling you, don't play with fire. If you play with fire, you will burn your hands. It is your wish. You want to be safe by listening to OET. Don't listen to Simon sir. Simon sir doesn't know anything. OET. Listen to OET. Don't listen to me. I'm least bothered. So what OET is demanding? So B2 vocabulary, this also, you are getting 250 to 290. 250 to 290. You are getting C grade. Okay. Then 200 to 240 also. All this C grade. Then otherwise it is a D grade and E grade. We don't want all those things. Okay. Okay. Now here I want to ask you one thing. Do not follow me. Do not trust Simon sir. Trust OET. Are you ready to trust OET? Say yes or no fast. Yes or no. If you say yes, I'm with you. If you say no, go with somebody else. I want a yes or no. If you say no, also no problem for me, but I want a response. I'm not teaching to rocks and stones. I'm teaching to human beings. Yeah. All of you, write your names, please. Those who are new people, those who did not write your first name and second name. This Manal Uthman, something different. Okay. So this is what it is. So this is what you have to follow. Now I am telling you, C2 is giving you A grade, C1 is giving you B grade, D2 is giving C grade. But not this is, you see now, I have shown you here. Okay. Now introduce is B2. The word introduce is B2. Now let us see. Introduce is B2. The word I am giving you, introduce. Introduce. Introduce is B2. Okay. And here, refer is C2. Now, which one you want to use? Why do you want to use the word introduce when you are already refer is there? Refer means to introduce only. Refer means to refer means, okay, to introduce. Refer means to introduce. I am referring somebody to you means you don't know that person, so I'm referring him to you. That's the meaning. The other person doesn't know. So that's why you're referring. So now you want to use introduce or you want to use refer, you use your own word. Refer is C2. That's what is important. So I have shown you already. Refer someone to somebody is, yeah, refer someone to somebody. Yes. You see here. It is C2 vocabulary. Refer is C2 vocabulary. To direct someone or something to a different place or a different person for information, help or action, often to a person or group with more knowledge and power. I don't know what to do with this patient, so I am referring to a specialist. It's a C2 vocabulary. Now it is your wish, whatever you want to do. So there's a very valuable information. So for making the patient or treatment the focus of sentence, so make it the subject of the sentence, focus of the sentence. Don't say I am referring. I is becoming important. That means I become the focus. Don't bring I. Okay. Don't bring yourself there. Right? Using it during writing and speaking subtest. Using it during writing and speaking subtest can help your language be more sympathetic. I am writing to refer means you are great. The patient is not important. Okay. So as nurse or a doctor, you can use your language to build better relationships with patients. So if you use passive voice, you are building better relationship with patients. So instead of pitting the performer of the action, who is the performer? You are the performer. So why are you bringing yourself? The passive voice makes the person or the patient or thing being acted on the subject of the sentence. Make it the subject of the sentence. I think it is enough for you now. Okay, that's the point. So now I'm asking you, do you agree? If you agree, I'll teach you passive voice. If you agree, I'm going to teach you passive voice sentences. Otherwise, you write whatever you want. I want a yes, if you agree. Okay, you want the best things, so I will give you the best things. So you should be ready for that one. Okay, if you say no, also no problem for me. You can just openly tell something. Don't be dumb like a stone or a wall. I want you to be active and give some information. Okay, yes or no, no problem. Be daring enough to say no if you don't agree. I'm fine with it. I'm totally fine with it. Okay. Right. So this is how you're going to write. Now coming to the point. I am writing to introduce Miss Osburn. So, comma, who requires, okay, who requires ongoing care and appropriate management. Okay. So that is it. So now which you want to write? I is important means you can write this one. This is low quality. See how much big the sentence is becoming. And we know that you are writing a letter. There are some people who write, I am writing this letter to you in order to introduce Miss Osborne, who requires ongoing care and appropriate management. Beating around the bush and making a nonsense out of common sense. Who is bothered about who is writing this letter? Nobody is bothered. They don't even mind all these things. We only want to know about Miss Osburn. We don't want to know who is writing this letter. Let some Tom, Dick and Harry write the letter. We are least bothered about that. Okay. This is the best sentence. Okay, you are saying, okay, I am writing this letter to you in order to introduce. Introduce is B2 word, refer is C2 word. So that's it. Here is, this is a good sentence. Good sentence. You will pass if you write this sentence, but if you do one mistake, you will fail. You will fail, definitely. Okay, so be careful. But if you write like this, there is no difference. So that's the point. So your wish, how you are going to write. I don't want this sentence in my letter. Miss Osborne is being referred for ongoing care and appropriate management. Okay. Right. Okay. So where? Community Health Center, Woodville. So this is the facility. Okay. Appropriate management from your facility as she is moving to Woodville to live close to her daughter. Finished. Right. Miss Osborne, comma, who has been treated for, what is that? Who has been treated for what? Hypertension. What is the problem here? Who has been treated for what? Hypertension. Who has been treated for hypertension. So Miss Osborne, who has been treated for hypertension, is being referred for ongoing care and appropriate management from your facility as she is moving to Woodville to live close to her daughter. Or, okay, who has had hypertension for the last 10 years is being referred for ongoing care and appropriate management from your facility as she is moving to Woodville to live close to her daughter. Or you can write in 2 sentences. This is A grade sentence. Otherwise, you can write like this. Miss Osborne, okay, Miss Osborne has had hypertension for the last 10 years. She is being referred for ongoing care and appropriate management from your facility as, or you can say since, because, okay, anything, as she is moving to Woodville to live close to her daughter. Or you can write in 3 sentences. Miss, this will give you A grade, this will give you B plus, okay, and this is going to give you B grade. Miss Osborne, okay, has had hypertension for the last 10 years. Okay, for the last 10 years, she is being referred for ongoing care and appropriate management from your facility. Full stop. She is moving to Woodville to live close to her daughter. So 3 different types of sentences. There you can write 100 different ways. 100 different ways. Okay. So whichever way you want to write, you can write. You can write. Depression is just 2 years. Okay. The most important thing is hypertension. Because of hypertension, only depression. Hypertension is the most important problem. Okay. Hypertension is the most important problem. If hypertension is not there, there is no depression. So main root cause is hypertension. Okay. Root cause is hypertension. Right. So major problem is this one. Right. So other than that, anything you write, it will be ordinary style. So this is the best. This is the best. This is the best. This is the better. This is good. So your wish, whatever you want, your wish. Your wish, however you want to write, you can write. Okay. You can also write like this. This is also better. Miss Osburn, comma, who has had hypertension for the last 10 years, is being referred for ongoing care and appropriate management from your facility. Full stop. She is moving to Woodville to live close to her daughter. So like this. So this is the best. These two are the better. You are joining any 2 sentences into one and the other one separate. So you can write 100 different ways, I told you. Okay. You can write, I am writing to refer. I am writing this letter to refer. I am writing this letter to refer. What all you want to write, you can write. That is your wish. Okay. This only is good. So these two are better. This is the best. Now you can do whatever you want. Okay. So clarity with introduction. Clarity achieved. So you can just give your yes or no. That's all. So that we can move into the body paragraph. Okay. Just fast. Yeah. Very good. Now, we are going to the body paragraph 1. This is the introduction. Now we are going into the body paragraph 1. This is 2. This is 3. Right. Okay. Now coming to the body paragraph 1, main body paragraph 1. Okay. Main body paragraph 1. Okay. So here in the main body paragraph 1, you will write the important things. What are the case notes that will go here? You have to think about that one. Okay. Right. What will go into first paragraph? What will go into second paragraph? What will go into third paragraph? Right. So now first thing what you have to do is you have to explain the main problem. Okay. You have to explain the main problem. So why you are referring her? What is it? Everything you have to tell here. Okay. Now, let us see. Let us pick and choose the relevant information. Okay. Right. Now here, she has a medical history. This will go into the first paragraph. This is the main thing. This is the first one, medical history. Okay. Medical history. This will go into paragraph number 1. This will go into paragraph number 1. So these two things. So number 1, copy text. So the medical history. This is most important one. Medical history, there are two things. Number 1 is hypertension and number 2 is depression. Yeah. This will go into the main body paragraph 1. So medical history. Okay. This is the most important one. Medical history will go into here. 10 years hypertension and 2 years depression. Okay. So it's a long time. Okay. The next one. Next one is, so what are these two problems? And now for these two problems, she is taking the medications. The medications. Hypertensives for hypertension, antidepressants for depression. These are the medications. These are the medications. So you are taking the medications. Medications. What are the medications? Let us see. Antihypertensives. And then antidepressants. So for hypertension, she is taking antidepressants. And for depression, she is taking, for hypertension, she is taking antihypertensives. And for depression, she is taking antidepressants. Okay. Fine. So that is done. So medications. So these are the two relevant information regarding medical history and medications. They are interrelated. You have to combine these two things. Next one. Next one is, right. Now here, next one is periodic problems with self-administration of medication. This is the next problem. This is another problem. So this is compliance with medication. This is compliance with medication. Medication compliance or non-compliance. Medication non-compliance. Medication non-compliance. She has this medical problem, so she is taking these medications, but while taking this medication, she has non-compliance. See, these are all related. These are all related information. Related information. I think you can understand now. So, medication, medical history, and for that medications and medication non-compliance. So they are related here. They are very much related here. They are very much related here. Fine. Then next. So what is the problem here? Medication non-compliance. That means she has problems. So for this one, she is not able to, she has periodic problems. She has problems. She cannot take self-administration of medication. She is not able to manage. So that managing self-administration of medication is a problem. Okay, it's a problem. So what is required for this one? Such a solution is required for this one. Solutions. Solutions. So permanent solutions. What are the permanent solutions here? So you can see here. periodic problems with self-administration of medication. So for that one, you have to ascertain medication compliance. Medication compliance is to be ascertained. Okay, she requires assistance regarding medication compliance. So that's it. So for treating, she requires regular monitoring and to ascertain. Now we are doing, but there she has to do all these things. To ensure, ascertain means ensure. Now what is this word ascertain? Ascertain is a very special word. Ascertain. I don't know how many of you know this word. Ascertain. Ascertain is a formal word. Ascertain means is a formal word to discover something, to make certain of something, to make certain, to make sure. Okay, to make certain means to make it possible. Ascertain means to make it possible, to make sure, to ensure. Okay, ascertain is a formal word. Formal word. Use these formal words in your writing. But this word is already there in the case note, so don't use this word. So you can use the word ensure. Somebody write these notes and keep them. Ensure. Now ensure means make sure. Ensuring. To make sure something certain to happen means ascertain, same thing. Okay. Right? Ensuring means to make sure. So, right. To ascertain medication compliance. Right? Monitoring medication compliance. Monitoring, regular monitoring of medication compliance is required here. See how I am collecting the information. Very good. Harjinder Kaur. You are attending the session. Very good. Okay. Regular monitoring of medication compliance. If you are regularly monitoring, that means you are ascertaining. If you are regular monitoring, that means you are ascertaining. Regular monitoring to ascertain medication compliance. So you are the community nurse and you are in Woodville. So no need to repeat this one because you are there in Woodville. Already you are there in Woodville and you are the community nurse and you are in Woodville. It is there in the beginning of the letter only. We have already mentioned in the beginning of the letter itself, community nurse you are and you are in Woodville. So why should we repeat these things again? Okay. So these things are eliminated. These things. So by community nurse, that means the person who is taking this is unnecessary. This is irrelevant. Don't take this one because we have already mentioned. We are writing to community nurse. So no need. They are going to live in Woodville. They are in Woodville. So we don't need to write it because it's already mentioned. So regularly monitoring to ascertain medication compliance. So this is required. This is permanent solution. Copy text. So this is the permanent solution. Okay. Permanent solution is regularly monitoring what? Regularly monitoring what? To ascertain medication compliance. To ascertain medication compliance. This is permanent solution to this one. So all these go into the medical history. So the main body paragraph 1. Main body paragraph 1. Okay. The next one. Body paragraph 2. So let us separate this one. Now body paragraph 2. Now in body paragraph 2, what we have? So we have 4 things: medication, medical history, the medications, medication non-compliance, permanent solutions to achieve medication compliance. Okay. So these are 4 related: medication, medical history. So this is the medical history. So he is taking this medication. She is taking these medications, but she has problems with this taking medication. So she is non-compliant. So to maintain compliance, medication compliance, to achieve medication compliance, you have to monitor regularly and ensure. So ascertain, achieving. So achieving, you can use the word achieving. Achieve. Achieve. So achievement, okay. So you have to succeed, okay. The end result is this one, achievement. So fine. So how are you going to make sentences of these things? This is called finding relevant information. Finding relevant information, right? Okay. Now let me see. Let me tell you one point. Lady Justin, welcome. Yeah. Now let me ask you one question here. So, paragraph main body paragraph 1. MBP 1 means main body paragraph 1. So, did you understand how I chose? Did you understand how I chose MBP 1 relevant information? Yes. Hit the button. Yes, first. So we'll move to the second paragraph. Yes. Anybody is there going for the exam on 25th February? 25th February. We have a crash course for this 25th February. So you can contact me for regular letter corrections and speaking evaluations. Anybody is interested, you can. And all of you, write your test date, please. Test dates, please. If you are already booked, write your test date. If you are not booked, no problem. Yeah, you can contact me for regular letter corrections. Okay. So, Atira Vimal, yeah, you are already registered for a crash course. So what about the others? Anybody is interested? You can get back to me. So I'm showing you the corrections. Our corrections are 3 different levels. I'm going to show you one particular correction. Writing corrections, different types of corrections we have according to the seriousness. So this is one letter correction. Yes. This is one letter correction, classical corrections. So everything will be given here like this. Even a comma is missing, it will be there given here. This is a doctor's letter, medicine. Okay. For each individual letter, if anybody comes to me, I will charge 500 rupees individually, but it is a course that is different. If anybody wants to crash course, okay, you can join. The fees and other things will be informed to you. Okay. So everything will be given like this. This is one type of correction. Okay. This is one type of correction. Yeah. So different styles of corrections are there. Right. So this is my contact address. So my number, or most of you know my number. So I have only 3 places remaining. 3 places remaining for this new batch. So yes, whatsapp.me. Copy link. Yes, this is the, yeah, you can just send me a message now if you are really serious. First, those who send me first message, them only I will take. Okay, first preference according to your request. Timing. I want to join in the crash course. Okay. So those who are exam dated 25th February. Okay, test date. For them only I am taking. Only 3 places remaining today. Only 3 places. I don't take too many students. Only 3 students. Yeah, good evening, Mira. So 3 students only can request. First 3 students I will take. First of all, I'll see whether you are really serious. Then only I will give you admission. Even if you pay fees, that is not important for me. Those are really serious for crash course. Okay. So if you are really dedicated to pass and clear OET, then you join. Otherwise, don't come to me, please. Right. So regular monitoring to ascertain. So these are the 4 different main body paragraph. First, you will write the medical history. That means she has hypertension and this is depression. This is hypertension and this is depression. And this is medications. For this hypertension, we use antihypertensives. For this depression, we use antidepressants. So these are the medications she has to take. She has been taking. But she has problems, medication non-compliance. That means she has periodic problems with administration of medication. So this is a medical condition. This is a medical condition. And this is the medication for this medical condition. And this is medication non-compliance for these medications regarding this medical condition. And this is the permanent solutions for this medication compliance for these medications in order to manage this medical condition. So these 4 are interrelated. Medication, medical history, and these medications to manage this medical history. Medication non-compliance, not satisfactory regarding these medications to manage this medical history. So in order to manage this medication non-compliance, so you have to make them compliant. So permanent solutions for compliance of these medications to manage this medical history. These are 4 interlinked. One is medical history, medications for managing this medical condition. So she's not able to manage with these medications, non-compliance. So make sure compliance solutions. That's it. Regular monitoring of these medication to achieve compliance for these medications to treat this medication condition, medical condition. So they 4 are related. So this is a medical history. Paragraph 1 is entirely regarding medical problems. Medical problems. These are called special problems. Specific problems. Specific problems. So that means this is specific information. And next paragraph number 2 is generic information. General information. General information. General information. So this is about the medical problem. This is about the patient's problem. This is talking about entirely about other histories. This is medical history. Specific information is medical history. This is talking about medical history. And this is talking about general information. That means general history. What do you mean by general history? What do you mean by? Yes, anything is there, you just send the message in WhatsApp, please. I'm ready to listen to you after the class. Just message. Anybody who is interested in that one? Okay. Okay. Then I will talk to you there. Okay. So, right. So main body paragraph 2 will talk about the other things. What are the other things? The other things are, so personal history, then social history, and then habits. Okay, habits. Okay, and conditions, general condition, all general things, personal history, social history, family history. Family history. Okay, lifestyle, okay, and other conditions, similar, general condition, all the general things should come here. All the, I have shown you already. Those who missed the session, please go to YouTube and learn these things. And I'll give you the link. All the regular students who are not bothered about the others. Okay. Now, so here it is. Where is this? Where is this? Yeah, here it is. Now, medical history, medications, non-compliance, problems, non-compliance, and this is solutions, permanent solutions. Now, other than that, alcohol consumption, alcohol, long history of excessive intake. This is long history, yeah. This is lifestyle. This is lifestyle. It is going into lifestyle here. It is going into lifestyle. So this increases, up arrow, increases, okay, when anxious. So this information, you know, from where we have taken. It's lifestyle. She drinks too much. Normally excessive alcohol intake, and it also increases uncontrollable when she's anxious. Normally only excessive alcohol consumption, and it increases when she's anxious. Normally only excessive, and this is beyond excessive. So try to understand the points here. Main body paragraph 2. So this is about the medical condition, what you know about her medical problems. This you know about her personal problems. Personal, this is personal. This is medical. I don't know how many points I'm giving. Okay, let me cut short. Let me bring. So this is medical. And this is personal. This is personal. Many people think, oh, we have attended these sessions many times, but every time it will be new. Okay. Many times, many people think, oh, I already taught me all these things. We know them. But every time my lecture will be different. General history. This is personal. Personal. Okay. First one is medical. Second one is personal. This is purely related to you as a nurse. This is purely related to the patient as an individual. And this is paragraph 3 is continuation. Continuation. This is, you can say, external. External, this is related to the nurse, the community nurse. This is the problem of the community nurse. It is her responsibility. It is her responsibility. Because I cannot do anything. The patient also cannot do anything. So it is your responsibility. Mind you. From now onwards, it is your duty. So this is what we have done. This is what I have taken care till now. This is what the patient is doing for herself. This is what you are supposed to do. Okay? I'm handing over this responsibility to you. Because I cannot do anything more now because she is transferring from here to Woodville. So I cannot do, even if I want, I cannot do. The patient cannot do it on her own. So it is your responsibility now. So this is the responsibility of your responsibility. Till now, it is your responsibility. Paragraph 1 is your responsibility. Paragraph 2 is the responsibility of the patient. Paragraph 3 is your responsibility. The second nurse's responsibility in Woodville. Yes. So remember that one. So long history of excessive. So this is lifestyle. This is lifestyle. So what else is coming? Let us see here. So now she is retired. She is retired. She is retired. Right. She is living on, surviving on pension, age pension, old age pension. She's surviving. This is financial story, financial background, financial history. Okay. Financial history. So financial condition. This is financial condition. So this is financial condition. Financial condition. And here, she is surviving. Her income is only age pension. She is not depending on it, but she is getting some pension, old age pension. So this is the point. Try to understand. And now family history. Family history is there. So she lives alone. She used to live alone, present. Now she is living alone in a rented house in Newport. We need not tell this one to her because she doesn't need. She is not going to live anymore in Newport. So this is irrelevant information. This is not required. Danger zone. This is irrelevant information because she is not going to live anymore in Newport. She is going to Woodville, moving to Woodville in a rented, in Woodville close to live her daughter on doctor's request. So this is relevant information. You should identify which is irrelevant and which is relevant. Okay, now already we have written this one. So moving to rented 1-bedroom unit in Woodville, close to daughter on daughter's request. So now let us take this one. This is relevant information. Okay, this is relevant information. So she's moving to rented 1-bedroom unit in Woodville close to her daughter. That means she's living alone. She is going to live alone and daughter will come and go off and on. She will be monitoring. She will not stay with her mother, but she will come and watch now and then. Okay. She is not totally alone now. At least for some time, daughter will come sit with her in the morning, afternoon, evening. She will bring food. She will take care of her, whatever she requires. Some things when she want to go to hospital or community health, or nurse will come here, whatever it is. Okay, somebody is there. So now that is the point. Right. This hypertension is the medical. We already got this one. Right. So one daughter, she has only one daughter. And she is married. Remember that. So this daughter cannot stay with the mother. And mother doesn't want to stay with daughter. Otherwise, she will go and stay with the daughter. No? Only one daughter. So this daughter requested her to come there. That's why she is moving there. She has nobody else. And she is divorced. She is lonely. She needs somebody. Right. So next. Now let us see. Alcohol intake. So this is another one. Alcohol intake. So regular monitoring of medication compliance and alcohol intake. Regularly monitoring. So copy text. So nursing management and progress, regular monitoring by community nurse in Woodville. Remember this. This is that nurse should take. So this will go into third paragraph. This will go into third paragraph here. Regular monitoring. This nurse has to take care of this regular monitoring and medication compliance, and also alcohol intake. So these two things she has to monitor. Regular monitoring, number one, medication compliance, and number two, alcohol intake. Yes. So these are the two things that she has to monitor. Next, we got that information. So community nurse and Woodville, no need to, because it is repeated. Next one, discharge plan. Discharge plan. So now here you have to see, now already we have seen here, monitor medication compliance, alcohol intake and diet also. So this is repeated here. Monitor medication compliance, alcohol intake and diet. Diet also is coming now. So and number 3, okay. Number 3 is diet. Diet also. Diet also should be monitored. Dietary requirements. Dietary requirements. Okay. So these are the 3 things that she has to monitor. These are the 3 things that she should regularly monitor. The next one. Next one, second thing is encouragement is required. Encouragement is required. So she has to encourage. What she has to encourage? First one is she has to monitor. Second one is she has to encourage. She has to encourage. So copy test. So encouragement. Encouragement is required. Okay. Continuous encouragement. So what she has to encourage? Now let us see. First one is expansion of family and social activities. Family get-togethers. So first one is family activities, expansion. She has to expand, means increase the number of visits of the doctor. Yes. Number 1. Number 1. Family activities. Family activities, and number 2, social activities. Family activities. Family activities is number 1. Next, number 2. Number 2, family meetings, you can say. Family meetings or get-togethers. Not only her daughter's husband and her children, everyone will be there. They are not mentioned, but you can just say like that, family meetings, family get-togethers. Arranging family get-togethers. Okay. So, next one, social activities, involvement in social activities. So we'll change it into next point, involvement in social activities. For example, elderly citizens clubs and voluntary groups. So participation, involvement. So elderly citizens clubs and voluntary groups, club activities. So these are the things she has to monitor and encourage and involve. Right. So now, so she should establish contact with medical practitioner after the move. Immediately after she moves there, this is very important. Everything is relevant here. So they did not give too much of information. All the information is almost important. Okay, straight to the point it is. So this is the main thing. Establish contact with medical practitioner means the doctor. Because if any problem is there, first contact should be there and keep the doctor informed. Okay. So these are the points here. Establishing contact with medical practitioner after shifting or transferring or relocating or moving to some other place. So moving, relocation. Relocation means changing places. So establishing contact, regular monitoring, encouragement, involvement. So these are the 4 points you can use, 4 sentences. Here we have 4 points: medical history, medications, medication non-compliance, and permanent solutions. Then here, second, body paragraph 2, body paragraph 3, establishing contact and regular monitoring, encouragement, expansion, involvement in social activities. And here, personal history, social history, family history, lifestyle and conditions. So now family history, only one daughter. Only one daughter. Only one daughter. And personal history, okay, retired. Is she retired? So is she retired from work or something like that? Income is just aged pension. Nothing about, okay? Nothing about retirement, nothing about work, nothing, anything else. So leave it. So, yeah, personal history, lonely, okay? Staying alone. Staying alone. So this is the point here. Lonely and staying alone. Moving to rented 1-bedroom unit in Woodville close to a daughter. So only one daughter. And long history, excessive. So all the points have come here. You can see every bit of information is there. Every bit of information is there. You can see here. Okay, body paragraph 2. And this is main body paragraph 3. Yes. Yeah, medical history is 1 paragraph. Social history and personal history is 2nd paragraph. Medical is separate totally. Don't mix medical history with personal history. Personal history is not that much important. Medical history is more serious problem. The more serious problem will be in the 1st paragraph. The other less important problems will be in the 2nd paragraph. Follow-up action will be in the 3rd paragraph. That is what it is. Medical condition is serious problem. So this is the most serious problem, medical history. Very serious problem. So that is the first part. This is not a problem. Lonely and staying alone is not a problem. Moving to rented, this is not a problem at all. She has only one daughter. That is not a problem. Okay, long history of exercise, no problem. Okay, financial income, no problem. This is no problem area. This is problem area. This is the problem area. This is the no problem zone, and this is the care zone. This is care, ongoing care, continuity of care. This is the care zone. This is the care zone. This is the serious zone. Medical problem is the serious zone. Serious, urgent needs, serious zone. This is the general, means ordinary zone. I'm telling you all the different types of explanation I'm giving you. So you should know by now how many letters you might have written. So let us see here. Introduction is related to purpose. Then next one, main body paragraph 1. Main body paragraph 1 is related to serious problems. Main body paragraph 2 is related to ordinary things. Main body paragraph 3 is related to care. Yeah, course of action or care or action plan. Okay, action plan for what? Not for ordinary things. Action plan for serious problems. So this and this are very important. Okay, right. Next one, conclusion. Conclusion is related to reiteration of purpose in a different angle. Okay. So you should know this. Okay. You should know these points. Now I want to ask you one question finally. We have picked up all the relevant information. Relevant information. Any doubts? So if you have doubts, say yes or no. If you have doubts, say yes. Otherwise, say no. 10 seconds only. Come on, fast. So, Adhira Vimala, very good, thank you. Binsi Mol, thank you. Manal Osman, thank you. Sebokotse, very good. Ushas, good. Joseph, good. What about the others? You don't know whether you have doubts or not? You don't know whether you have doubts or not? Now what should I tell you? Please, fast. I need encouragement so that I will explain you the sentences. And I'm going to teach you how to write these sentences, transform sentences. Okay, now what I will do is, I will take the names of these 6 students and note them down, and I will call them personally, and I'll send a new link, and I will only teach those 6 students. Very good. So what are their names? Let me write down. Come on, fast. So who is the regular student here? Yeah. Yes, Binsi Mol or Mira, any one of you, please, or both of you, write the names who has said no doubts, sir. Some comment. give their names to me personally, then I'm going to invite, I'm sending you, I'm closing this link and I'm sending you a new link only for those students who are ready to send no doubts. Okay. Others, they don't want sentences. I think they are very clear. Now I'm going to teach you how to write A grade sentences. A grade sentences. Okay. Now, okay. How many, okay, who is interested to recreate quality? Who is interested to attend the next session? Write your names. Write your names. Yeah. If all of you write your names, okay, then I'll keep you there. Those who are not mentioning the names, I'll just remove them out of this chamber. I can just remove them. Okay. Those who are interested only, those who are ready to learn, them only, I'll give you. Very good. So, very good. Now I can see the names. Manal Osman. Okay. So I am taking the names. Very good. Very good. Do you think? I don't know. Yeah. These are the students who are going to stay with me now. Manal Osman, number 1. Okay. I will get it fast. Don't think I don't get. Number 2, Noor Alam. Number 3, Mans Simane Musang. Number 4, Atira Vimala. Number 5, Harjinder Kaur. Number 6, Suja Chellam. Number 7, Pranita Pamarti. Number 8, Binsimol Thomas. Number 9, Usha Binu. Number 10, Sebokotse Halale. Number 11, Meera Manoj. Yes. Yeah. So 11 students are there here. Okay. If you are guests also, no problem. Just type your name. Okay. So these 11 students are going to get the link. Okay. For the second round. Right. These are the 11 students. Right. So fine. Now this is the way how you are going to get these points. Fine. Now let us go into sentence construction. Yeah. Now these 11 students and whoever is there, I want to ask you one thing. Shall we continue or shall we have a break? A for continue, B for break. Type A or B. A or B. Yes. Majority vote. Majority vote. Majority vote. Thank you very much. I am very tired. I will have a nice meal now. Yeah. Sujachalam, your internet is not working properly, okay? Sujachalam, your internet is not working. How can you say you want to continue? I don't know. Huh? Yes. So majority. Yeah, Binsimol, check how many want to continue. Meera Manoj, check how many wants break. Just count the number. Binsimol, count how many wants to continue. And Meera, count how many wants to take break, please. 4 want to continue. Okay, what about break? Meera, just check. Eight B. Okay, fine. 8B. Thank you, Musang. 8 want to break and 5 want to continue. Okay, majority is B. So break. We'll meet after the break. Now I am asking you one point. Break is A 10 minutes, not 10 minutes. I need at least 15 minutes to eat something. So A is 15 minutes, B is 30 minutes, C is 45 minutes. So choice. Dr. Noor, count how many B's are there. Minsimol, count how many A's are there. Atira, count how many C's are there. So 4 B's. So majority is B, only 2A. Fine. So we'll meet after 30 minutes. Okay. I'm giving you 1 minute to give your feedback, valuable feedback. And those who have sent me a message that you want to join the crash course, okay? Yeah, I'll get to you on personal WhatsApp. So this is my personal WhatsApp. Okay, the link will be sent to you after 30 minutes. So those who want to join, you can just send a message that I want to, because this is going to be a very special session. Do not miss and give your valuable feedback. Number 1, grade your gain. What profit you gained? 0 to 10. From 0 to 10, what is your gain proportion? If you got nothing, then write 0. If you got 8, everything, then you write 10. If you got 50, then you write 5 points. Whatever you want. Yeah. So then next one is write one sentence. Write just one sentence regarding the session and what you liked. Number 2, point number 2 is what you liked. And number 3 is what you expect more. What do you expect more? Manal, can I correct you? Concise spelling is this. Okay. Yeah. That is what we are going to do now. Organization, you got it. So how to write sentences, we are going to learn now. And you can bring any number of friends in the second session. So I'll send you the link. You can bring anybody, whoever you want to bring, you can bring, because this is the last free session for this week, or maybe 15 days. This is going to be the last session, free session. Others will be only for the regular students. Yeah. See, yeah, you can ask anybody you want. Today is an open session. See you after 30 minutes. Sorry, I typed wrongly. Okay, see you after 30 minutes. Yes, that's the end of the session.